So we all know there are surgeons. Surgeons are a specialist among the doctors who is trained in performing operations or surgeries. So the training of a surgeon is not a simple task, both for the teacher or for the student. So of course, the teacher student usually used in school days, but most of the times the surgeons will get trained in a teaching hospital, and teachers are called as professors, assistant professors, associate professors, like that, and the learner are called residents. In a surgical training, initially the residents are trained in acquiring clinical skills. Clinical skills are nothing but history taking of the complaint and clinical examination of the patient to come to a diagnosis, and then also next they will understand how to diagnose a condition by further evaluation by investigations. After coming to a final diagnosis, whether the patient needs a surgery or not is the next rotation. Once the patient needs surgery, whether it needs to be done on an elective basis or emergency basis, the next skill they learn is how to manage patient pre-operatively. After learning this, they learn how to manage the patient post-operatively. So post-operatively, what are the guidelines you have to follow? What are the instructions to be given? Whether to take the food or not? What are the fluids to be given? So what are the medicines to be given? So how to monitor the patient? It may take for the monitoring maybe for hours in a case of daycare surgery. It may be for days and weeks depending upon the surgery. After learning the clinical skills, pre-operative management, post-operative management, then they come to the operation theater where initially they observe the surgeries done by different surgeons. Then they will assist surgeries. After assisting a good number of cases, once they get confidence, they will do start surgeries, especially under the under the supervision or under the assisted by the senior faculty. Then they start doing surgeries assisted by junior faculty. Then they will start doing surgeries under supervision where the senior surgeon won't come in that, only they will manage independently. Once they start doing surgeries independently, then they start teaching their juniors by making them do. So once they are able to do independently, almost they would have attained perfection. But the moment they start teaching to the juniors means they definitely attained perfection in that particular surgical skill. So the surgical training is entirely different from a medical training or a radiologist getting trained or a paraclinician pathologist, pharmacologist or a microbiologist, all this getting trained. Because for a medicine person, usually a patient is enough, and if you have good knowledge also, it's also enough. Even though the teacher might not be there, the training of a medical branches like general medicine, dermatology, pediatrics, all these things are entirely different from a surgical training. For a surgical training, definitely not only the patient, not only the knowledge, but definitely a guide or a senior surgeon should be there for a good surgical training. But it is not in the case of a radiologist or general medicine. Of course, there also the teacher is needed, but in surgical training, definitely the need will be more.